you're gonna feel a lot of cold.
I feel a lot of cold right now.
Right. So you're gonna feel a lot of cold. And so what's happening right now? Remember, I told you, even though the laser penetrates through the skin, it's gonna protect you. Okay.
Right.
The cold is protecting you. That's why if you look at the laser head, you see all the 4 green lights. That's really for your protection because it's telling us we have skin contact on all 4 areas. Okay.
I feel it. All I feel is cold right now. That's it.
In about 2 minutes, all you're gonna feel is cold. Then after 2 minutes, you're gonna start to feel some heat. Okay. And the heat is sort of, you're feeling it really broken up into 5 zones. So you see 4 here. 1 zone they don't even put on there because that means it's too hot. We want to stop it. Okay. So you're sort of in the first zone now, where you really feel a pleasant, cool or cold setting, right?
Okay.
If you're still in that zone at 2 minutes, we'll increase it a lot. Okay. So, but then around 2 minutes, you should start feeling some gentle warming and cooling. That's zone 2. If it's just gentle warming and cooling, then you're still too low. Okay. When you get into zone 3, you're going to feel tingling, and then you feel intervals of warmth. So it's like it seems to cycle about every 30 seconds. So you get cold and then warmth and cold. It's sort of like sine waves. Okay, where the top of the wave is where the heat's going to be. Okay, so if you have a little tingling and nice gentle warmth at the top of the wave, we're in zone 3. That's a good zone. Okay. So and then zone 4 is also a good zone, but it's more moderate heat. If it gets to a point that it's really hot, that you can't tolerate it, just tell me. There's no reason. You're in a bad zone. Okay.
It's too hot for me. Okay.
Yeah,
All right, I'll tell you.
You tell me if it's too hot. And I sometimes you think in the beginning, oh, this is a piece of cake, turn it up, and then we turn it up, and then you say after about 6 minutes, you think, no, it's too hot. It goes down. Just because you thought it was, you turned it up, doesn't mean you have to suffer afterwards. Okay. We'll adjust it. Okay.
Now tell me. So what could I expect? So. Right now, when I put on my shirts, I put on my jeans, I always have an overhang of this muffin top. Without question.
So we're going to reduce the fat there 25%. So I'm not going to tell you after 1 treatment you're still going to have you're not going to have a little bit of a muffin top. It should be smaller.
But it should be small.
But maybe if we do it a second time, then we can get rid of it the second time. Okay. And of course, as I said, it's an alternative to surgery. With surgery, we get rid of it once, but then you have a 2-hour procedure. You have a little anesthesia, you have a recovery, you have a little puncture when we did it. So this is clearly
right now I'm feeling a little bit of like heat sensation.
Feeling a little bit of heat.
Just fine.
That's perfect. You're at about 2 minutes. How would you describe it if we looked at these grids?
Yeah, look a gentle warm.
So you're in zone 2.
Yeah.
Okay.
A little tingly now, like a little warm and cooling. Like
so now we're in zone 3.
I think so. Yeah, it's like. Yeah, it's intervals of warmth and cooling.
And it's a little tingly.
Ew.
Yeah, so you're in zone 3. Okay, that's a good zone. They call it zone 3. They call it the destruction zone. They don't call it the killing zone. That's like something from a movie, right?
Right.
So this is the destruction zone.
So what would you say for someone like me who so who would you say this procedure is best suited for? Is it someone that has like a regular BMI? Is there anyone that
the ideal
candidate?
The ideal candidate could be somebody who has a BMI, under 30.
Under 30, okay.
It's going to be somebody who really doesn't need skin tightening. Okay. And
like you said, for the skin tightening, this is not really going to work. That's why you wouldn't recommend it on my stomach, which is where I need.
Right, it's not going to work. If you have the skin tightening, you're either going to need a surgical procedure or you're going to need a radio frequency or laser procedure to tighten the skin as well. Okay, and remove the fat. I gotta go check.
Okay, yes, go check. So now.
How are you feeling?
Come closer so you can see the.
How are you feeling?
It's fine. It's like a tingling.
Which zone are we in?
I feel like I'm still in.
Zone 3.
Yeah, maybe getting a little into 4. It feels a little warm. It feels a little warm. Yeah, it feels a little warm.
Okay, so you're comfortable where you are.
Yeah, I'm fine.
Yeah, and you feel that you're in one of these 2
Yeah,
zones.
yeah, because I feel
you're not here. You're not at gentle warming.
No, I feel like as soon as it gets a little warm and then it starts feeling tingling.
Cold, right, and tingling, and then it gets cold right away.
Then it gets cold right away, right. It's not staying warm.
It doesn't stay warm.
No. As soon as I feel like it's getting too warm, then it starts getting cold again.
That's good. You get a little tingling. You're in the perfect area. Okay. So I'm just gonna keep you at the setting where you are. There's no reason to change it. Okay.
Now after this is done, can I work out? Anything like?
Do whatever you want. You have no restrictions.
Wow, no restrictions.
You have no restrictions.
I'm going to work out. First, I'm going to get my hair done, and then I'm going to go work out.
So you're getting everything done.
You know what? That's what we should do. We should let you have your hair done while you're sitting here.
Yes.
Really, a spa treatment.
I mean, look how simple it is.
It is. I can have my nails done here. I can have my hair done. I can get a facial.
And lose 25% of your fat. That's great.
Okay. Well, thank you very much. I'm gonna, once it's done. So, when should I take the pictures after? Like when would I be the optimal, like the result show?
Well, we probably should 12 weeks. We should probably
12 weeks.
We'll take some
Okay.
pictures of you. You might start seeing results at 6 weeks, but we can do it at 12 weeks. And the studies were all extended out to 12 weeks. Although some of the investigators were reporting that patients said they continued to see improvement up to 6 months.
Wow.
And that makes sense. I mean, that makes sense from everything else we do. Okay? And you can get get a little soreness there, okay? Very mild, okay? If you look at on the instruction sheet, it said to do massage afterwards. None of my patients have really been doing it. I think it's really if you get some
Well, I
hardness.
think he can massage me after. That's
He can do it, yes. Yeah, right, exactly. I think that's required. He signed that, didn't he? It was part of the deal.
Sorry, you gotta massage me now.
Yeah, it was part of the deal.
All right, so thank you very much.
You're welcome. So basically, you have a call button.
I have a call button right
and
here.
You can get the nurse or me or anyone, but you're really it's amazing because for a laser, most lasers, people are going to say, can't be a laser. She's not wearing eye protection. This laser, the FDA does not require eye protection because it will not work unless it's flat against your skin. So there's no escape of laser light, so you don't have that risk. And you're still in that comfortable zone?
Totally.
Totally. Okay.
Yeah.
So I'll come back in a few minutes and check if you need me. And if you do need me, you have your little
I have
button.
my little button.
Right. And try it. Let's make sure it's working.
In the middle? Oh, look, it beeps.
It beeps us. Okay?
Okay,
All right.
thank you.
You're welcome. Take care. Bye.
Okay, bye-bye.